When applying for a master's in learning disability nursing, the interview typically focuses on assessing your passion for the field, your understanding of the role, your ability to work with vulnerable individuals, and your readiness for the academic and practical challenges of the course. Below are some common interview questions you might encounter, along with tips for how to approach them. Why do you want to pursue a career in learning disability nursing?
What they're looking for. They want to know about your motivation for choosing this career path and your passion for supporting individuals with learning disabilities.
How to answer. Share your personal experiences, whether professional or academic, that sparked your interest. Highlight your desire to make a positive difference in the lives of people with learning disabilities, and emphasize any related work or volunteering experience. What do you understand by the term learning disability?
What they're looking for, they want to test your foundational knowledge of learning disabilities and how well you understand the diversity within this field.
How to answer. Define learning disability in a clear, precise manner, mentioning the different types of learning disabilities, such as intellectual disabilities and developmental disabilities. You could also refer to the social model of disability, which focuses on removing barriers and supporting inclusion. Can you describe a time when you supported someone with a learning disability?
What they're looking for. They want to assess your practical experience and empathy in supporting people with learning disabilities.
How to answer. Provide a specific example from your past work, volunteer experiences, or personal life. Focus on the challenges you encountered, the strategies you used to help, and the outcomes. Show your ability to be patient, understanding, and creative in supporting others. How do you plan to manage the academic workload and practical placements required for this MSc?
Well, they're looking for our time management, organizational skills, and readiness for the demands of the course, right? I've successfully balanced academic and work commitments in the past by creating a structured study schedule, prioritizing tasks effectively, and seeking support whenever necessary. These strategies have always helped me stay on top of my responsibilities.
What skills do you think are most important for a learning disability nurse?
They want to know our understanding of the key competencies required for the role. I believe empathy, communication, especially nonverbal communication, patience, problem solving, and the ability to work in a multidisciplinary team are crucial. Also, resilience and adaptability in dealing with challenging situations are essential skills for a learning disability nurse.
How do you approach working with individuals from diverse backgrounds?
They want to assess our cultural competence and ability to work inclusively with people from different backgrounds and experiences. I understand the importance of cultural diversity and respect for individual differences. I always tailor my care approach to suit the specific needs of each person. In my previous roles, I've worked in diverse settings, which has really enriched my perspective and skills in this area.
What are some of the challenges you might face as a learning disability nurse?
Well, there are quite a few challenges. First, there's the emotional strain that comes with the job. You really have to manage complex care needs and sometimes deal with societal stigma around learning disabilities. Navigating the healthcare system can also be pretty tough.
They want to see if you can think critically about the challenges and complexities of the role.
To overcome these challenges, I think self-care is super important. Continuing professional development helps a lot too, and collaborating with the team can make a big difference.
How do you handle stress or difficult situations?
I usually handle stress by staying really focused and calm. There was this one time when things got really hectic at work. I managed my emotions by taking a few deep breaths and then just focusing on the task at hand.
They want to understand how you deal with the emotional and practical demands of the nursing profession.
My coping mechanisms include mindfulness, seeking support from colleagues, and sometimes just taking a short break to clear my head.
How do you think the role of a learning disability nurse differs from other nursing specialisms?
The role of a learning disability nurse is quite unique. It requires a person-centered, holistic care approach that's different from, say, physical health nursing. Communication is key. and advocating for the individual's rights is a big part of the job.
They want to see if you have an understanding of the distinct nature of learning disability nursing.
Plus, the role is very interdisciplinary. You work with various professionals to ensure the best care for the individual.
Where do you see yourself in 5 years' time?
They want to assess your long-term commitment to the profession and career aspirations.
How to answer? Outline your career goals, whether it's to specialize in a particular area of learning disability, nursing, pursue leadership or teaching roles, or continue your professional development. Show that you're dedicated to growing within the field. How would you work with a multidisciplinary team to provide care to a person with a learning disability?
They want to see if you understand the importance of teamwork in healthcare settings and how you would contribute to a collaborative environment. Discuss your understanding of the roles of different professionals, like doctors, social workers, and occupational therapists, and how you would work together to provide holistic care. Emphasize the importance of communication and collaboration to ensure the best outcomes for the individual.
What do you know about the current issues facing people with learning disabilities?
They want to assess your awareness of the wider societal, political and healthcare challenges impacting individuals with learning disabilities. Mention issues such as access to appropriate healthcare, social inclusion, employment, education, and the challenges of navigating a healthcare system that may not always meet the needs of people with learning disabilities. Show that you're aware of ongoing reforms and policies affecting the sector.
What qualities do you think you bring to the nursing profession?
They want to understand what makes you a strong candidate for the program. Discuss personal qualities like compassion, resilience, empathy, and a strong work ethic. Provide examples from your experience that demonstrate these qualities in action.
Tips for success. Be genuine and reflective. Think deeply about why you want to become a learning disability nurse and how your background has prepared you. Show passion and commitment. This field requires a deep sense of empathy and a desire to make a difference, so convey your genuine interest and dedication. Prepare questions. At the end of the interview, be prepared to ask insightful questions about the program, placement opportunities, or support systems for students.